this picture is a picture of someone with pitting edema. Okay, edema is another word for swelling. We often see it in the lower extremities, the feet, the ankles, the legs, etc. Okay, and when I say pitting, what do I mean? I mean it actually when you put your finger in the skin, okay, it actually leaves a dent. And we can see that with this picture here. You see the dent? This rather, is an example of pitting edema. Now, I want to talk a little bit about this today. I also want to show you how you would know if you have pitting edema. Pitting edema is relatively common. A number of conditions can cause it. I'll talk about those in a moment. But first, let me actually show you a video of how you would be able to tell if your edema is pitting or non-pitting, okay? So take a look at this. By the way, this video is from a Dr. Oz segment I did a number of years ago, and this is something that we did on air. Take a look.
Usually the front of the leg on the side of the bone. Push your finger in, and then when you release the finger, you want to see if a dent remains. And you do have a little bit of a dent here. Absolutely, yeah.
Yes.
Is this something you've talked to your doctor about?
Yes.
Yeah, okay. Well, good. You're doing the right thing. You're doing the right thing.
So I hope that's helpful. Even in this video, we happen to call it the press test, but that's not necessarily a medical term or an official term that I've ever heard used medically. We simply take our thumb or a finger and we press it on the side or, on the leg, okay? You want to hold your finger there for about 5 seconds at least. And then when you release your finger, if it's pitting edema, you'll see literally a dent that remains, okay? Now, just so that you know, pitting edema tends to be graded. What do I mean by that? We can tell how severe, or doctors and healthcare professionals, we communicate with each other about how severe the pitting edema is by a grading scale that we give of 1 to 4. 1 meaning the milder form of pitting edema, 4 plus meaning a more severe form. And there's a little bit of give and take in terms of exactly how that's defined, but we know that if somebody's got 4 plus pitting edema, it's pretty significant, okay? 1 plus being a lot less, all right? And what is this? Why is it that if in people with pitting edema, you put your finger in and the finger stays there? Well, it really has to do with movement of excess interstitial water in response to the pressure, okay? Movement of excess interstitial fluid, okay? So now look, this is the thing. Many of us have swelling for different reasons. I have another video on potential causes of leg swelling in general. I'll make sure I link that here. It will also be in the description of this video as well. If you're watching on Facebook, please DM me if you don't see it. But let me give you a few examples of things that can cause pitting edema. Sometimes it can indicate that there are what we call systemic illnesses going on in your body, meaning there could be something going on with your heart, something going on with your lungs or your kidneys or even your liver. Now, I know that that's pretty broad. It doesn't have to be those things, but it could be. There are plenty of other medical conditions and other things that can cause pitting edema as well. So the big takeaway here is for you to, number one, understand that if you can put your finger in and it leaves a dent, you've got pitting edema. And what should this tell you to do? Well, just like anything, I want you to see your doctor. Now, I don't want you to necessarily assume that the cause is something bad, okay? Well, your doctor's got to determine what the cause is. And remember, the differential or the range of things it can be is pretty wide, okay? But just know that if you see this, well, hey, this is probably some excess fluid that you got going on. And what do you need to do about that? Well, you got to see your doctor to figure out what's going on and to figure out how to treat anything underlying that is happening with your body. So wanted to mention that. I hope that's very helpful. Hope that's helpful, rather. There is also non-pitting edema. We tend to see that in things like lymphatic obstruction or thyroid conditions, thyroid problems, perhaps other things as well. Let's see here. What was I going to say? I have a video on lymphedema that I will also make sure that I link here so you can see that as well. I have other videos on edema as well, and I'll keep them coming because I know that it's something very important. There are medications, just so you know, just in general, this is aside from what I've been talking about, there are medications that can cause swelling, other things. So I know I'm just like, other things, but anyway, I think it's important to understand what pitting edema is. And if you see it, make sure you see your doctor. Okay, so let me know what you think. Let me know if you have any swelling in your legs. I always like to know because I often say that what you say and what happens to you often, you help other people. I'm Dr. Jen. It is good to see you. I do daily videos on all sorts of things. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel. Click the little bell for updates. Also, please subscribe to my daily daily, but my weekly health newsletter, go to my website, www.drjencaudle.com. Also, I'm on Instagram, WhatsApp, TikTok, etc. Please follow me at Dr. Jen Caudle. All right, guys. Bye.